The image of the Old West often conjures up saloons, cowboys, and gunfights. These iconic scenes have been immortalized in countless movies and stories, painting a picture of a rugged and untamed frontier. Yet amidst the dust and grit, another figure played a vital role in these rugged communities: the barber. Often overlooked in the grand tales of the Wild West, the barber was a cornerstone of frontier life. Far from just offering haircuts and shaves, these individuals were often the primary source of healthcare in towns lacking dedicated doctors. They were the unsung heroes, providing essential services that went beyond grooming. They were versatile practitioners, tending to a wide range of needs, from trimming beards to pulling teeth. In many cases, they performed minor surgeries, treated wounds, and even set broken bones. The frontier barbershop was a social hub, a place where men gathered to exchange news, gossip, and seek the barber's services. It was a place of camaraderie, where stories were shared and bonds were formed. These establishments were often simple, one-room affairs, furnished with a few chairs, a mirror, and an array of intriguing tools. Despite their modest setup, they were vital to the community's well-being. The air would be thick with the scent of bay rum and tobacco, creating a uniquely masculine atmosphere. This distinctive aroma became synonymous with the barbershop experience, adding to its charm. In an era where life was often harsh and unpredictable, the barber provided a sense of normalcy and care. Their role extended beyond mere grooming. They were confidants, healers, and pillars of the community, offering a touch of humanity in a wild and often unforgiving land. One of the most daunting services offered by the barber surgeon was dentistry. With limited access to trained dentists, people turned to these makeshift practitioners for relief from toothaches. Extractions were the most common procedure, often performed with a pair of pliers and a fortifying shot of whiskey for pain management. The tools might have been crude, but the barber's understanding of basic anatomy and their steady hand made them a valuable resource. They understood the importance of hygiene, sterilizing their instruments in boiling water to prevent infection. While the experience was undoubtedly painful, the barber's intervention provided much-needed relief from agonizing toothaches. The barber surgeon's toolkit was a fascinating blend of grooming and medical instruments. Alongside razors and scissors, one would find forceps, scalpels, and bone saws. These tools, often crafted from polished steel, were designed for both elegance and functionality. The straight razor, a symbol of the barber's trade, was a meticulously maintained instrument, sharpened to a fine edge on a leather strop. The same razor used for a clean shave could also be employed for minor surgical procedures, highlighting the resourcefulness of these frontier practitioners. Their ability to adapt and utilize their tools for multiple purposes was a testament to their ingenuity and skill. The barber chair, a fixture in barbershops today, played an even more significant role in the Old West. This sturdy chair, often made of wood and leather, was designed to be adjusted for various procedures. For a simple shave, the chair would be reclined, providing the barber with easy access to the client's face. However, for more complex procedures like tooth extractions or wound treatment, the chair could be adjusted to a more upright position. This versatility made the barber chair an indispensable piece of equipment in the frontier barbershop. The iconic barber pole, with its spiraling stripes of red, white, and blue, is a vestige of the barber surgeon's medical past. This symbol, which is now commonly associated with haircuts and shaves, has a much deeper and more complex history that dates back to medieval times. The pole itself represents the staff that patients would grip during the procedure of bloodletting, a common medical practice in earlier centuries. Bloodletting was believed to cure or prevent a variety of illnesses by balancing the body's humors. The red stripes symbolize the blood drawn during bloodletting, a practice that was often performed by barbers who doubled as surgeons. This was a time when the roles of medical practitioners were not as specialized as they are today. While the white represents the bandages used to staunch the flow, these bandages were essential in preventing excessive blood loss and aiding in the healing process. The white stripes thus signify the care and attention given to patients after the procedure. Over time, the blue stripe was added, often representing the veins, or in the United States, a nod to patriotism. The addition of the blue stripe helped to complete the visual narrative of the barber pole, making it a more comprehensive symbol. The barber pole serves as a visual reminder of the barber's historical role as a healer and a bridge between the worlds of grooming and medicine. It stands as a testament to the evolution of medical practices and the enduring legacy of barbers in the history of healthcare. The barber's role extended far beyond haircuts and shaves. They were often called upon to treat a wide range of ailments, acting as de facto doctors in communities where medical professionals were scarce. Their services included dressing wounds, setting broken bones, and even administering basic medications. Their knowledge of human anatomy, gained through their work as shavers and surgeons, gave them a basic understanding of the human body. They relied on a combination of herbal remedies, folk medicine, and practical skills to treat their patients. While their methods may seem rudimentary by today's standards, they provided essential healthcare in a time and place where options were limited.
As the 19th century progressed and the American frontier expanded, the demand for more sophisticated medical care grew. The establishment of medical schools and the rise of professional doctors led to a gradual decline in the role of barber surgeons. People began to recognize the importance of specialized training and knowledge in medicine. Legislation was enacted to separate the practices of barbering and surgery, leading to the development of distinct professions. The barber surgeon, once a pillar of frontier healthcare, slowly faded into the annals of history. Section 8. The Enduring Legacy. Barbers in the Annals of Medicine. While the era of the barber surgeon may be long gone, their legacy continues to resonate in the world of medicine. The barber pole, with its symbolic stripes, remains a recognizable emblem of the profession's roots. The barber's chair, with its adjustable design, continues to be a staple in barbershops worldwide. Moreover, the barber's role as a trusted confidant and community figure endures, reminding us of a time when these skilled individuals were entrusted with not only our appearances but also our well-being. Section 9. The Barber's Tale. A glimpse into the past. Stepping into a modern barbershop, it's fascinating to imagine the stories those walls could tell. Tales of toothaches soothed with whiskey, wounds stitched with a steady hand, and the camaraderie shared between barber and client in the heart of the Old West. Though the tools and techniques have evolved, the essence of the barber's craft remains. The skilled hands that wield razors and scissors still possess a touch of the barber surgeon's legacy, a reminder of a time when these individuals played a vital role in the health and well-being of their communities.
Section 10. The Evolution of Grooming, from Frontier Necessity to Modern Luxury. The barber's trade has undergone a dramatic transformation since the days of the Wild West. What was once a necessity for hygiene and healthcare has evolved into a sophisticated industry focused on aesthetics and personal style. Barbershops today offer a wide range of services, from classic haircuts and shaves to beard trims, facials, and hair coloring. The tools of the trade have become more specialized and technologically advanced, with electric clippers, straight razors, and a vast array of grooming products at the barber's disposal. Section 11. Conclusion. The Barber of the Old West. A fading memory. The barber of the Old West, a figure both rugged and refined, played a pivotal role in shaping the social fabric and healthcare landscape of the frontier. In those days, the barber shop was more than just a place for a haircut or a shave. It was a community hub where news was shared and stories were told. The barber was a trusted figure, someone who knew the secrets and troubles of the townsfolk. They were more than just barbers. They were dentists, surgeons, confidants, and community healers. In an era where medical professionals were scarce, barbers often stepped in to fill the gap, performing minor surgeries and dental extractions. Their skills were indispensable, and their presence was a comfort to many. Their legacy serves as a testament to human resilience, ingenuity, and the enduring human need for connection and care. The barber's chair was a place where people could find solace and relief, both physically and emotionally. It was a place where the community came together, and bonds were strengthened. While the days of the barber surgeon may be long gone, their impact on the communities they served is still remembered. The empty barber chairs and deserted streets of old western towns stand as silent witnesses to a time when barbers were central figures in daily life. Their story continues to captivate our imaginations, reminding us of a simpler time when the barber's shop was a cornerstone of the community. The tales of their exploits and the lives they touched are still told today, keeping their memory alive, offering a glimpse into a bygone era where the barber's chair was a place of both grooming and healing. It was a place where people came not just for a haircut, but for comfort, advice, and a sense of belonging. The barber of the Old West remains a symbol of the enduring human spirit and the timeless need for community.